Nail fungus, those pesky infections that turn your once healthy nails into thick, discolored nightmares, are more common than you might think. Whether it's a single toe or multiple nails, dealing with nail fungus is frustrating and can impact your confidence. Many people struggle with this condition, especially as it's often tricky to treat and easy to catch. The good news? There are effective medications out there to help you reclaim your healthy nails. In this video, we'll delve into the top 10 best medications for treating nail fungus. From powerful oral antifungals to topical treatments, we'll cover everything you need to know. Number 1. Terbinafine. Terbinafine is one of the go-to medications for treating nail fungus, and for a good reason. Taken orally, terbinafine works from the inside out, attacking the fungus at its root. With a 38% complete cure rate, it's one of the most effective treatments available. If you're dealing with a stubborn fungal infection that just won't quit, terbinafine might be your best bet. For fingernail infections, you'll typically take one 250mg tablet daily for 6 weeks, while toenail infections usually require a 12-week course. However, it's not all sunshines and roses. Like any medication, terbinafine comes with its share of side effects. Some people experience headaches, gastrointestinal issues, or even a rash. In rare cases, it can affect your sense of taste, which might be permanent. Liver function is another concern, especially for those with pre-existing liver conditions. So it's crucial to consult with your doctor and have regular checkups while on this medication. Number 2. Itraconazole. Itraconazole is another oral antifungal that's often prescribed for nail fungus, though it's slightly less potent than terbinafine. With a 14% complete cure rate, it's still a viable option, especially for those who may not tolerate other medications well. Itraconazole works by inhibiting the growth of fungi, making it harder for them to survive and spread. For fingernail infections, the typical dosage is 200mg capsule daily for 7 days. If it's your toenails that are affected, you're looking at a 12-week treatment period with one 200mg capsule daily. As with any medication, there are precautions to consider. Itraconazole is not recommended for people with heart failure or liver disease, as it can exacerbate these conditions. Side effects can include damage to the heart or liver, gastrointestinal problems, and mild diarrhea. It's also not suitable for pregnant women, so if you're expecting or planning to become pregnant, this might not be the right choice for you. Number 3. Tavabarol. If oral medications aren't your thing, tavabarol might be an option worth considering. This topical antifungal comes in the form of a nail solution, making it a non-invasive alternative to pills. Although its complete cure rate is only 6.5%, it's still a decent choice for those looking to avoid the systemic side effects of oral treatments. Tavabarol works by inhibiting a key enzyme in the fungus, preventing it from growing and spreading. The treatment involves applying a 5% solution to the affected nail once a day for a lengthy 48 weeks. While it's relatively safe, tavabarol isn't without its downsides. The most common side effects are localized, such as exfoliation at the application site, skin rash or erythema, and dermatitis. These effects are usually mild and temporary, but it's always a good idea to monitor how your skin reacts and consult your doctor if anything unusual occurs. Despite its lower cure rate, tavabarol could be a good option for those who prefer a topical approach or cannot take oral antifungals. Number 4. Efinaconazole. Another topical treatment on the list is efinaconazole, which offers a slightly higher complete cure rate of up to 17.8%. Sold as a 10% topical solution, efinaconazole is designed to be applied directly to the affected nails daily. This medication works by disrupting the cell membrane of the fungus, effectively killing it off over time. While it requires patience, daily application for up to 48 weeks, efinaconazole is a viable option for those who prefer a more targeted treatment. Side effects of efinaconazole are generally mild and limited to the application site. Some users may experience blisters, dermatitis, or eczema. In rare cases, you might notice an ingrown nail or experience upper respiratory symptoms like a cold or sinusitis. However, these side effects are uncommon, and many people tolerate the treatment well. If you're in it for the long haul and prefer a topical solution, if fluconazole could be the right way to go. We made a book, 10 questions everyone should ask their pharmacist. You can find the link in the description below. Feel free to check it out. Number 5. Cyclopirox. Cyclopirox is another topical antifungal that has been around for a while and is considered effective by many dermatologists. It's available as an 8% nail lacquer which you apply daily to the affected nails. Over time, cyclopirox penetrates the nail and works to kill off the fungus. With a complete cure rate of 8.5%, it's a middle-of-the-road option, especially for those who are just beginning to explore treatment options for nail fungus. Like other topical treatments, cyclopirox comes with a few mild side effects. You might experience a burning sensation, irritation, or redness at the application site, but these effects are usually temporary. For those looking for a non-invasive treatment that's easy to use and relatively effective, cyclopirox is a solid choice. Just remember, like all topical treatments, it requires consistent application and a fair amount of patience. Number 6. Griseofulvin. Griseofulvin is an older treatment that's still in use, particularly for severe fungal infections. Unlike most other medications on this list, Griseofulvin doesn't work by killing the fungus outright. Instead, it prevents the fungus from infecting new nail growth. This means that as your nails grow out, the old infected nail is gradually replaced by new, healthy nail tissue. However, newer antifungals like tryptophan and itraconazole have largely overshadowed Griseofulvin due to their higher efficacy. The treatment regimen for Griseofulvin can be quite lengthy, lasting 4 months for fingernail infections and up to 6 months for toenails. And since it's an oral medication, it does come with its share of side effects, including headaches, dizziness, and gastrointestinal issues. It's also not recommended for people with liver problems or certain autoimmune conditions. Despite these drawbacks, Griseofulvin remains a viable option, particularly for those who haven't had success with other treatments. Number 7. Fluconazole. Fluconazole is another oral antifungal that's used to treat a variety of fungal infections, including nail fungus. It's not as commonly prescribed for nail fungus as terbinafine or itraconazole, but it's still an option, especially for those who may have allergies or contraindications to other treatments. Fluconazole works by inhibiting an enzyme necessary for the fungus to reproduce, effectively halting its growth. The dosage and duration can vary depending on the severity of the infection, but it's typically taken once a week for several months. As with other oral antifungals, fluconazole comes with potential side effects. These can include nausea, abdominal pain, and in some cases, liver damage. It's also important to avoid alcohol and excessive sun exposure while on fluconazole, as these can exacerbate side effects. Regular blood tests may be required to monitor liver function during treatment. Despite these precautions, fluconazole is a useful alternative for those who need a different option. Number 8. Amorolfine. Amorolfine is another topical treatment that's particularly effective for mild to moderate cases of nail fungus. It's available as a 5% nail lacquer, which you apply once or twice a week to the affected nails. Amorolfine works by disrupting the production of ergosterol, a crucial component of the fungal cell membrane, effectively weakening the fungus and preventing it from growing. While it may not be as potent as oral treatments, it's a good option for those who prefer a less invasive approach. One of the advantages of amorolfine is that it has fewer side effects compared to oral medications. The most common issues are mild irritation or a burning sensation at the site of application, but these are usually temporary. However, it's important to note that amorolfine is most effective when used in the early stages of infection or in conjunction with oral antifungals for more severe cases. If you're looking for a low-maintenance topical option, amorolfine is worth considering. Number 9. Combination therapy. For those dealing with particularly stubborn or severe nail fungus, combination therapy might be the most effective approach. This involves using both oral and topical antifungal treatments simultaneously. The idea is that the oral medication works from within, attacking the fungus systematically, while the topical treatment targets the fungus directly at the site of infection. This dual approach can increase the overall effectiveness of the treatment and may help speed up recovery. However, combination therapy is not without its challenges. The increased use of medications can also mean an increased risk of side effects. It's crucial to follow your doctor's instructions carefully and report any adverse reactions immediately. Regular monitoring, especially of liver function, may be necessary. Despite these potential downsides, combination therapy is often recommended for severe or persistent infections that haven't responded to a single treatment method. Number 10. Alternative treatments. While oral and topical antifungals are the mainstays of nail fungus treatment, there are alternative options that some people might find appealing. One of the most talked about alternatives is laser therapy, which uses focused light to destroy the fungus. Although still relatively new, laser treatment is gaining popularity for its quick sessions and lack of systemic side effects. Another emerging option is photodynamic therapy, where a light-sensitive drug is applied to the nail and then activated with light, killing the fungus. On the other hand, there are plenty of home remedies that people swear by, like tea tree oil, vinegar soaks, and even garlic. While these may have anecdotal success, they generally lack the clinical evidence needed to be recommended as reliable treatments. If you're considering any alternative treatments, it's essential to consult with a healthcare professional to ensure they won't interfere with other medications or exacerbate the condition. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications. And cheers to a healthy life!